Oh my gosh, Madeline, I am so excited to have you here today. I have been preaching to new and expecting families how it's so important to have a village behind you when you're pregnant or have a new baby. And you are one of the fantastic experts I'm so honored to have on our talk. So I want to introduce you all to Madeline, who's a registered physiotherapist. Madeline, welcome, and please introduce yourself and tell us a little bit about what you do.
Yeah, well, thank you so much for having me. On the other end, being a podcaster myself, I'm usually the one like doing all the starting off. So it's nice to be on the other side. So my name is Madelaine Golick. I am a registered physiotherapist I practice out of Mississauga, Ontario. My focus of my practice is in pelvic health, primarily helping women or birthing individuals prepare for labor and birth, and then obviously the postpartum rehab that comes afterwards. That's like one of the areas that I absolutely love to focus my attention on. And this is why we're here to talk about this, because you're absolutely correct when you say it takes a village, and we've kind of lost those pieces. Like we're kind of like in these like individual silos. Like I got a silo over here and I got, a silo over there. And I truly believe that the future of helping individuals have positive birth experiences is within that village context.
That's so great. Well, I'm so happy to have you here today. So before we get started, I know that this last year has made a bit of a change for many of us professionals working with families. So I know that you're located in Mississauga, but do you also do virtual work for families?
Yes, I do. Yeah, that was I've been very familiar with Zoom for a long time now. We use a slightly different platform, but essentially it's the same process where we do audio, video, and I meet with people virtually. And yeah, it wasn't a far jump for me to make it over into the virtual realm. I did have to do a little bit of a webinar right at the beginning just to figure out like how exactly to structure like pelvic health on the virtual platform. But now that I've been doing it over a year, it's like I look back and I go, like I feel like I've been doing it forever now. Like I've got this system and the system's working, and it's just such a phenomenal opportunity for us to reach people that we otherwise would have not been able to reach. Or sometimes people don't want to see us in person. Like they maybe don't want some of the hands-on pieces, but they need the education and the guidance and the exercise piece that can be totally done over virtual. So it's super exciting to have this realm open up.
That's right. And I'm glad, because with pelvic health, I think it's a category, especially that many people don't actually look at and can really affect us physically and eventually emotionally. So I'm really excited to have you chat. And today we're chatting about worry-free childbirth. So let's get to it. So I'm going to ask you a few questions, and
Sure.
I would love for us to sort of dive in. So tell me a little bit about the common challenge that you hear from parents in terms of what you support them with pelvic health pre and post baby.
Yeah, so some common themes certainly are centered around tearing. A lot of women are concerned about, what exactly is going to happen down there and how they might be able to prevent it from occurring. We also get a lot of worry about pain, right? Because you see in, media, you see it in movies, you hear from other people. And oftentimes, you hear more of the unpleasant feelings and sensations that sort of occur versus more of the, positive end, like, oh my gosh, yes, that was intense. However, I was able to do this, and this to actually make it through. So we tend to hear and see things more on a skewed perspective. And so it really creates a lot of anxiety, fear, uncertainty, tension. When we think about when the time actually comes, am I going to be able to deal with this? What if I can't get an epidural? What if I do? What if it doesn't work? What if I have to get an intervention? And so it creates a lot of physiological responses within us that gets things really kind of riled up, and it doesn't, it tends to start to set in as like the pregnancy progresses, because in the beginning you're kind of dealing with the pregnancy and it's exciting, and then you're tired, maybe you're dealing with some nausea, and then that sort of settles, then you start getting bigger, and then you get bigger, and then you get bigger, and then you're like, oh my God, like there's no going back here. Like this baby has to come out one way or another, right? And then that's when some of that anxiety shows up.
You're right. And in all honesty, the anxiety, we know how closely connected our mental and emotional is to our physical. So we can manifest a lot of these things from happening. So it's great that they're able to prepare. Now, I know that you're able to support families one-on-one. So if they wanted to visit you in the clinic, or if they wanted to do a Zoom with you, or use your platform virtually, they can do that. But I wonder if there's a few tips that maybe you can give parents on how they can have, a little bit more of a worry-free childbirth and not having to think about these things. I know you're going to say planning for sure has to be one, but give us 3 tips of what you think they might be able to do.
Yeah. So one of the first things that I would say, and when I say worry-free, I use kind of an example here. Say it's a final exam. Okay. You have one individual who's prepared for weeks on end for this final exam, and then you have the person who's crammed overnight. Both are still walking into this exam with the butterflies and the nerves. Just which one is going to feel more confident about the outcome?
Absolutely.
Right?
Absolutely.
So it's, when I say worry-free, I don't actually mean literally you're not going to have any sensations of like a little bit of worry and stress. What I want people to like, so tip number 1 is kind of learning about what pain is, learning about how our nervous system works, and some of the cues that might alert us that we are kind of feeling a little bit stressed. Okay, so really it's about learning to identify our physiological state, understanding that we're feeling a little bit nervous, so that we then, through awareness, can impart a shift in that situation. So there are things that we can do to shift our attention away from the worry and the stress toward more relaxation. And obviously, the more relaxed you are, the better things are. So I would say education is number 1, because when you understand, you have the knowledge of how sort of things work and what the sensations all mean, it sort of takes a little bit of the unknown away. And then from the education, you can then apply techniques. So for example, one really great technique that I think is very overlooked in our society in terms of like for stress management and for worry is breathing.
Oh,
right?
Yes, absolutely.
We do it automatically, right? And the beautiful part about breathing that I don't think people understand is that it has this subconscious or automatic role and this conscious role where we can actually use our mind to change our breathing, that therefore changes some of those automatic processes that our nervous system conducts. So when we become stressed, our breath gets more shallow, it's faster, it's more difficult to impart relaxation to the rest of our body when we're breathing like
I agree with you. I agree with that.
Right?
Hyperventilating through your childbirth, for sure.
Right. So being able to cling to a breathing there are many breathing techniques. I'm not going to say one is better than the other. What I want to say is it's not just a matter of like, oh yes, I'm going to breathe. It's really actually tapping into the feeling of breathing deeply and releasing the tension on the long exhales. So it's more of a focus when you're breathing to work on long exhales. And the reason for that is that we know when we exhale, we are more in the nervous system that creates rest, digest, repair, reproduce, right? So we're more calm. And if you can kind of develop this ability to You know what I mean? Let your shoulders go,
Absolutely.
let your jaw go, relax your throat, because we know that like what's happening in your jaw and your throat and your shoulders is happening in your pelvic floor.
100%. 100%. That's great. So education, 1,
Yep.
breathing, 2,
Yep.
3.
So 3 would be working with, I would say, something like an affirmation. Okay. It can be really powerful to bring our mind. So one of the greatest powers that we as human beings have is the power to choose how we react, right? So when we have a sensation or some process happening that we can't control, if we can then use our mind with our breath to focus our attention on an outcome. So an affirmation could be, something to the effect of like, with every sensation, I move closer to meeting my baby, and you sort of just, you get into this almost hypnotic, meditative breath state where you're just, everything that you're focusing literally moment on moment with the affirmation, with your breath, every step is coming closer to my baby. And that can help, because the brain can't do 15 things at once, right? So if we can focus our mind away from stress and worry, redirecting toward something more positive, a positive outcome that we want to achieve, right? Then at least we're moving ourselves and our physiology further and further toward the outcome that we want to see.
I love this. You're reminding me of a speech I heard from an Olympian athlete who talked about how they prep when they're going to the Olympics. And a lot of it is emotional and mental. So this is almost like the birthing Olympics. We have to make sure we're educated and that we're breathing and that we're thinking positive for this to have a worry-free experience. So I love that. Those are some great tips, which are very nice to hear, because somebody who works with the body physiologically, it's so great to hear that you're touching on all the emotional aspects as well, because it's not always about the physical. And I think that's a great lesson that we've learned today. That's awesome. I want to ask you something personal now.
Sure.
Because it's a question that I get asked a lot. And I started asking everyone that I chat with, and I think there's a lot of value for our listeners and our viewers who are piping in. So tell me something you wish you would have known before you had kids. Something you wish you would have known before you had kids about pregnancy or childbirth or even postpartum.
Oh, yeah. I mean, it's interesting because there were so many things, even as a pelvic health physiotherapist, that like I really didn't know. And so I was highly motivated to really move toward knowing. I guess when I reflect back on my own birthing experience, that I didn't really know was going to happen was when I moved into transition. So transition meaning I'm moving from active labor to now we're moving into the pushing phase. And I didn't know that when I got the last cervical check, when I laid down finally on my back, because I had been in upright laboring positions most of the time, that I would be overcome with this overwhelming feeling of like not immobility. Like once I laid down, I just literally, like my focus and my energy just shifted, and I found it very, very difficult to move. And I didn't know that I should like alert my partner to sort of help me or get everybody who's there to help me get off of my back for the birthing. Because I knew I didn't want to birth on my back because it blocks the sacrum and it's not the most ideal birthing position. So
absolutely. Good for you for knowing that. Many people don't realize that.
Yeah. So I didn't know that I wasn't going to be able to muster the energy or even the speech to vocalize at that moment that I didn't want to. And I hadn't really talked to my partner about the fact that I wanted to not birth in that position. So that's like one of the things that I reflect on back that like I wish I had done is like spoken to my partner and the staff members about the more ideal birthing position. I mean, I managed to turn myself, like I try, because I was like, okay, if I can just get like at least my pelvis at a 45-degree angle, I know my like sacrum will move a little bit better. But you know, it was an uphill push battle on my back. So, you know, that was something I wish I knew. And well, you know, sometimes you can't know everything,
No,
but that was one of the
absolutely.
things that people should know is like when you make that transition, you know, let your partners know where you want to birth, because they may have to like really encourage you to move.
Right. And the birthing parent knows best. So it amazes me that we still live in a world where we're being told during childbirth every position, every move, every breath. So at the end of the day, follow your instincts and follow what feels good. Your body's telling you. So I love that you shared that tip, because I find that a lot of parents, after they've had their kids and they've grown out a little bit, up a little bit, and they think back, you know, I wish I would have known. It's sort of that question that, although we suffered through that question and wish we would have not, you know, taken that into a different step, it helps other people learn. So that's good
Absolutely.
that you had that experience and that you were able to enlighten everyone else. I'm so glad you could join us today. I know we have a few more talks scheduled for others to come and have a listen, but for the meantime, tell us where people can find you.
Yeah. So if people are really interested in diving into like this idea or this concept of like worry-free and the nervous system and like how to work with pain education, I actually did create a free mini training all on like different tips and tricks of how to shift your physiology back into a sense of safety, right? We want to try to be that create the feeling of safety as much as possible, because that allows us then to be more relaxed. So the best way to find me or to find that training would be just to go to courses.ecophysio.com/mini training. And the other place to really find me is Instagram. I'm literally the most active on Instagram, and that's just at Madelaine Golick, my name. I don't know if you're going to be putting it in the show notes, because the spelling of my name is a little different and usually nobody gets it right on the first go.
No, we
So
will for sure.
So go to the show notes so you get the right spelling. Find me on Instagram, and that's where I post all the different free offerings that I have and the trainings that I give, and everything is there.
That's great. Oh, Madelaine, I'm so glad you could join us today. Thank you so much. And we will talk to you very, very soon. Thanks, everyone.
Bye.